Welcome to the deep dive. Today we're getting into a topic that, well, it affects a lot of people, but it's often really misunderstood. Hidradenitis suppurativa, or HS. We've looked at sources covering diagnosis, the early stages, and basically what to look out for. Our mission today, break it all down, give you the key takeaways.
Yeah, and what's really crucial, I think, is understanding that HS is a chronic inflammatory skin condition.
Mm.
It's absolutely not contagious. And importantly, it's not caused by poor hygiene. That's a huge misconception.
Right, that stigma really gets in the way, doesn't it? Delays diagnosis sometimes for years, based on what we read.
Exactly. It's a medical condition, not some kind of personal failing. It usually kicks off after puberty. And yeah, it often gets mixed up with just bad acne or boils.
Okay, that confusion is key. So let's try and clear that up. How can someone listening tell if these, recurring bumps are maybe something more than just a regular pimple or an ingrown hair?
That's a really important point because getting it recognized early is vital. You might suspect early HS if you get these painful bumps that just keep coming back, and crucially, in the same places, typically armpits, groin area, inner thighs, maybe buttocks.
Okay, same spots.
Right. And unlike your average spot, these lumps might stick around, they don't heal fast, they can even burst and ooze,
Mm.
or sometimes form these little tunnels under the skin. They're called sinus tracts. Also, look out for pain, obviously, but also itching or burning.
Oh.
And sometimes groups of what look like double-headed blackheads sort of two join together.
Wow, okay. Those details are quite specific. It's easy to see how someone might dismiss it for years, thinking it's just stubborn acne, like you said. So with these signs, how does diagnosis actually work? Is there, like, one specific test for HS?
No, there isn't a single blood test or anything like that. The diagnosis is what we call clinical, meaning it's based on what the doctor sees during an examination and your whole history with the symptoms. A dermatologist is ideal, but a family doctor can also assess it.
Mm.
They'll ask how long it's been happening, how often flares occur, if anyone else in the family has it,
Okay.
and they'll examine the affected areas carefully. Part of that is also ruling out other things, making sure it's not cysts or maybe a fungal infection or, yeah, just severe acne.
Right, ruling things out. So what are the absolute must-haves, the key things a doctor looks for to say, yes, this is HS?
Good question. There are basically three core features they look for, kind of a checklist. First, you need the typical lesions. So that means things like nodules, those deep, painful lumps or abscesses, which are pus-filled, those sinus tracts we mentioned, and eventually scarring.
Okay, the specific kinds of bumps and tracks.
Second, and they need to be in the typical locations. Armpits, groin, buttocks, under the breasts, inner thighs, those areas where skin often rubs.
Got it. Locations matter.
And third, critically, it has to be chronic and recurrent, meaning it keeps happening. The usual benchmark is symptoms occurring at least twice in about a 6-month period. It's that combination, the what, the where, and the how often that points strongly to HS.
That makes sense. It's a pattern, not just a one-off thing. And who tends to get this? Are there known risk factors?
Yes, definitely. Certain things increase the chances. A family history is a big one if it runs in the family. Obesity and smoking are also significant risk factors. And hormones seem to play a role too. Lots of people find it flares up or gets worse around their menstrual cycle.
Interesting.
And statistically, it does seem to be more common in women, particularly between the ages of about 20 and 40.
So for anyone listening right now, maybe thinking, this sounds familiar. What's the best thing to do?
The absolute key takeaway is see a dermatologist early. The sooner it's diagnosed, generally the better the outcomes. And start keeping track yourself. Maybe take photos when you have a flare-up, note down when it happens, how painful it is. That info is really helpful for your doctor.
Good practical tip.
And please, don't try to squeeze or pop these lumps yourself. It can actually make the inflammation worse and lead to more problems.
Yeah, definitely sounds like something for a professional.
Right.
We actually pulled a quote, a patient tip from the sources that really hits this home. It says, if you've been getting recurring painful lumps in the same areas and they don't act like normal pimples, it's worth bringing it up with your doctor. HS can be managed better when caught early. Simple advice, but powerful. It really drives home listening to your body, right, and getting the right information. This whole dive really shows how picking up on those specific HS patterns can change everything for someone.
Absolutely. It's those details, isn't it? The double blackheads, the exact locations, the fact that it keeps coming back. That's what separates it from more common skin complaints. It needs that informed approach.
So maybe the final thought for you, our listener, is this. How could paying closer attention to those quiet, persistent signals your body sends, not just with potential HS, but anything lead you towards better health? Something to think about. Keep exploring.